Hi, good morning. My name is JR and today I'm going to be demonstrating how to assist a client in getting his or her vital signs. First and foremost, the first thing that you have to do is to make sure that your hands are clean to avoid spreading of the microorganisms and infection. And then you have to gather all the materials that you need, including the stethoscope, sphygmomanometer, tickler, thermometer, tri-pen, and the cotton ball soaked in alcohol. After gathering the materials, you may now go to the patient's unit. You have to knock on the door to show courtesy. And then once you enter the room, you have to identify the patient by looking at the head part, side part, foot part of the patient, or by simply checking the ID bracelet or ask the patient for the patient's name. Do not forget to greet the patient, introduce yourself, and then tell the patient the procedure. Hey sir, good morning. My name is JR and today sir, I'm going to be your caregiver. And today sir, I'm going to be assisting you in getting your vital signs. Okay? So, may I have your name sir? What's your name? Okay. So, we have to ask for the patient's name and then take note of the name of the patient. We also have to take note of the bed number and then the room number of the patient. So bed number 16, room number 32. Okay? And then we also have to take note of TPR-BP. TPR-BP is the pattern that we're going to be using in getting the vital signs of the patient. So T stands for temperature, P for pulse rate, R for respiratory rate, BP for blood pressure. So after getting the patient information, we also have to adjust the bed to its working level. So adjust it for about 20 to 30 degrees. Okay, and then after doing that, we also have to make sure that there is well-lighted room and there is a good ventilation inside the room. Okay? Or the room is well lighted and there's a good ventilation. Okay? So after doing that, we can now start getting the vital signs of the patient. So we're going to be starting in getting the temperature of the patient. In getting the temperature, we're going to be using the thermometer. So we have to get the thermometer from the receptacle. Okay? And then, before using the thermometer, we have to clean it first using our cotton ball soaked in alcohol. So we're gonna get a piece of cotton ball and then clean the thermometer from the tip or from the bulb of the thermometer. So we're gonna move it in a rotary motion until we reach the handle of the thermometer. Okay? Then, we're gonna discard the used cotton ball in the trash bin nearby. So we're gonna hold the thermometer on the handle and then we're gonna give it to the patient. Okay, asking the patient to put it under the axilla of the patient. Hey sir, can you put the thermometer, the tip of the thermometer, under your axilla or under your armpit? Make sure that you tell the patient to make sure that the tip of the thermometer won't touch the gown of the patient or the clothes of the patient for us to be able to get the accurate result of the temperature. Okay? Alright, so assuming it's not touching the clothes of the patient. So, and then, while waiting for the beep, we can now get the pulse rate and respiratory rate of the patient. So, in getting both, we have to position first the hand of the patient. In positioning the hand, we have to either put the hand of the patient, but before doing that, we have to ask permission from the patient. Okay? Hey sir, I'm gonna be getting your vital signs now. Can I touch your hand?
Yes, sir.
Okay? So, in positioning the hand, we're gonna place the hand of the patient on the abdomen of the patient if the patient is female. But if the patient is male, we're gonna place it on the chest of the patient. Since our patient is male, we're gonna position the hand on the chest of the patient. Okay? So after positioning the hand, we can now get the pulse rate of the patient. In getting the pulse rate, we have to palpate the radial pulse of the patient using our index and middle finger in 1 full minute. Okay, we're gonna count the number of beats per minute using our analog watch. So palpate the radial pulse and at the same time, look at your analog watch to count the number of beats per minute. Okay, so after 1 full minute, we're now going to be getting the respiratory rate of the patient. Okay, so do not remove your hand from the hand of the patient. Count the number of cycles per minute in getting the respiratory rate. Okay, and at the same time, observe the rise and fall of the chest of the patient for you to be able to count the number of cycles per minute. So 1 cycle or 1 inhale and 1 exhale is equal to 1 cycle. Do not tell the patient that you are getting the respiratory rate of the patient because the patient might be conscious and the patient might be controlling the breathing pattern of the patient, and that would affect the result of the respiratory rate of the patient. So count the number of cycles using your analog watch in 1 full minute. Okay, so after counting the number of cycles per minute, you may now ask the patient to give you the thermometer. Sir, can I have the thermometer? Okay, check the result. And then, before putting it back to the receptacle, you have to clean it first using the cotton ball soap and alcohol. Do the same thing, clean from the tip to the handle and then discard to the trash bin nearby. Put it back in the receptacle. Okay, put it in the box. And then record everything. Record the TPR of the patient. So temperature of the patient is 36.5 degrees Celsius. Pulse rate is 80 beats per minute. And then respiratory rate of the patient is 20 cycles per minute. Okay, so after documenting the TPR of the patient, okay, put that tri-pin in the tickler in the box and then get the blood pressure of the patient. In getting the blood pressure, we're going to be using the stethoscope and the sphygmomanometer. Okay? Before using the stethoscope, we have to clean it first using the cotton ball soap and alcohol. We're gonna get another piece and then clean the earpiece, the first side of the white tubing, and then use the back of the cotton ball in cleaning the other earpiece, and then the other side of the white tubing, and then discard in the trash bin nearby. Get another piece of cotton ball, soap and alcohol, clean the rubber tubing down to the chest piece. Discard in the trash bin nearby. And then, place the cuff, get the sphygmomanometer, and then we're going to be placing the cuff onto the arm of the patient. In placing the cuff, we have to make sure that there are 3 fingers allowance. 3 fingers allowance from the antecubital fossa. Okay? And you also have to make sure that the cuff is not too tight and not too loose by making sure that there are 2 fingers allowance inside the cuff. Okay? And then after doing that, we also have to put the gauge on the cuff for us to be able to see the systolic and diastolic pressure. So systolic is the first distinctive sound that you're gonna hear. And then the diastolic is the last distinctive sound that you're going to hear from the stethoscope. Okay? So, if the patient is hypertensive, we can inflate the cuff for about 200 to 220 millimeter mercury. But if the patient is in a good condition, we just have to inflate the cuff for about 160 to 180 millimeter mercury. Okay? So, after placing the cuff, we can now get the stethoscope. Okay? After getting, you can wear the stethoscope. And then before using the stethoscope, we have to make sure that we have to check first if it's working by tapping the chest piece. If you hear the sound, that means it's working, so we can proceed in getting the blood pressure of the patient. Okay? So after doing that, we can now palpate the brachial pulse of the patient using your index finger and then middle finger. Okay? Once you found the brachial area of the patient, put the chest piece on it. And then you may start inflating the cuff using the valve pump. Okay, since the patient is in a good condition, we just have to inflate the cuff for about 160 to 180 millimeter mercury. So inflating the cuff now. And then when deflating, using the valve, you have to make sure that it's slowly and evenly for us to be able to get the accurate result of the blood pressure. Okay? If you're not sure about your about the result, you may try to get the blood pressure again, do the same procedure after 20 to 30 seconds. Or you can transfer to the other arm of the patient for you to get the blood pressure of the patient. So after getting the blood pressure, remove the sphygmomanometer from the patient, and then before putting it back, before putting back the BP apparatus in the box, we have to clean the stethoscope again using the cotton ball soaked in alcohol. Okay? Assuming it's cleaned already. So after getting the blood pressure, you have to get the try pen and the tickler again to document the results. So the blood pressure of the patient is 120 over 80. So 120 is the systolic, 80 is the diastolic of the patient. Okay? Put it back in the box. And then after getting the vital signs of the patient, you have to adjust the bed to its working level and then tell the patient that you are done with the procedure. Hey sir, thank you so much for your cooperation. We're done in getting your vital signs. Do you need anything else? Alright. In case you need anything, you just have to ring the bell. The bell is just there beside you for us to be able to assist. Okay? And then you have to wash your hands after the procedure. And then you have to go back. And then go back to your working unit. Bring the materials with you. Do not forget to report that you are done with the procedure to your nursing supervisor or head nurse. And then that's it.